Welcome to the steps 4 and 5. These steps are central to the EVP process. These involve applying the recommendations based on research findings in previous phases to your clinical practice. These recommendations may come from a clinical practice guideline or from a set of studies and systematic reviews that we have carefully selected and appraised. Essentially, this is where we put evidence into action in our daily work. And as I will show you on this video, you will see that the evaluation of the outcomes is part of the implementation process. The integration of evidence into clinical practice takes place in a professional context influenced by many people and factors. Therefore, we need to consider the contents, organization, conditions, and environment in which we work. Moreover, implementation cannot be carried out by a single professional. It must be a team effort. But I must warn you that changing clinical practice in a healthcare service is a complex issue. Recent years have seen significant progress in studying methods to promote practice change and integrate research into clinical practice, known as implementation science. Numerous theoretical frameworks have been developed that provide a systematic basis for the steps to be followed in the implementation process within a practice setting. Process models are used to describe and guide the process of translating research into practice. Although each model may vary in certain aspects, they all include the 8 steps or phases shown in the figure. Identification of a problem, identification of participants and stakeholders, search for evidence, recommendations, and adapt them to the context, identify barriers and facilitators, planning of strategies and activities to be carried out, apply the change of practice, evaluate the observed change, identify activities to sustain change. In the following slides, we will briefly describe them and provide an example to enhance understanding. The first phase refers to identifying a problem that should be addressed. This may involve comparing what the current practice is with what should be in place in order to determine a gap that ought to be closed. The second phase means that it is important to identify the participants and stakeholders who will help to make the change possible. This could include nurses, clinicians, patients, associations, managers, etc. For example, imagine that you are a nurse that are working on a surgical ward. Over a 3-month period, 15% of immobile patients on your ward developed pressure ulcers. This rate is significantly higher than the hospital's target of less than 5%. You decide to create a work team, including 10 nurses, a wound care specialist, 2 physicians, and a hospital administrator. Patients and families are also involved to provide feedback on care preferences. In the third phase of the implementation process, we must search for evidence and recommendations that we want to implement. This could come from a clinical practice guideline, so we just need to adapt these recommendations to our context. And in the fourth phase, we need to identify potential barriers and facilitators to the implementation of knowledge. Following our example, you found a pressure ulcers clinical practice guideline and identified effective interventions: repositioning every 2 hours, skin assessments every shift, and the use of pressure-relieving devices. The recommendations are adapted to fit the ward's resources, such as ensuring all 25 beds have pressure-relieving mattresses and providing a checklist for skin assessments. In your context and with your team, you identify the following barriers: limited staff time, each nurse managed 8 patients, and a lack of knowledge about pressure ulcer prevention among some staff. On the other hand, facilitators include leadership support, funding for matrices, and motivated nurses. In phases 5 and 6, you and your team developed a comprehensive implementation plan, which you will apply over a specific period. You should carefully consider all the recommendations and select the activities that you believe will work best within your specific organization. These are, in fact, the phases in which the organization is prepared both cognitively, operationally, and emotionally for the change. In your plan, you address the following activities. Training, a 2-hour workshop on pressure ulcer prevention, is attended by the ward nurses, ensuring they are equipped with the necessary knowledge. Equipment. The hospital purchases 25 pressure-relieving mattresses and 50 sets of foam cushions to enhance patient care and comfort. Protocols. A checklist for repositioning and skin assessment is integrated into electronic health records to streamline documentation and ensure consistency. Additionally, it's crucial to plan activities for collecting data on key indicators to measure the effectiveness of the change. This includes tracking outcomes like pressure ulcer incidents, complaints with the repositioning protocols, skin assessment, and patient satisfaction, which will provide insight into how well the new practices are being implemented. Then you and your team need to implement the planned activities. Over a 12-month period, the new activities and protocols are put into practice. Monthly feedback sessions are held to address challenges, such as staff difficulties in consistently documenting complaints. Every 3 months, critical outcomes are collected, including pressure ulcer incidents, complaints with repositioning protocols, and skin assessment and patient satisfaction. In the 7th phase, you and your team must analyze the results of the outcomes collected during the application of the recommendations. This analysis will help determine if the interventions are positively influencing the desired outcomes as anticipated. The final phase, sustained knowledge use, involves ensuring the desired outcomes continue over time. To achieve this, you need to plan activities that integrate the recommendations into routine practice, making them a lasting part of the workflow. After implementation, you obtain the next results. The pressure ulcer rate decreased from 15% to 4%. Complaints with repositioning protocols reaches 90%. Skin assessment documentation improves to 95%. And patient satisfaction scores related to comfort increase from 75% to 88%. And finally, for the sustainability of the implementation, you plan the following activities. Quarterly audits are scheduled to monitor complaints and outcomes. Ongoing training is planned for new staff with annual refresher courses for all team members. Regular team meetings ensure continuous improvement. And new evidence will be reviewed every 6 months to update protocols. At the end of this process, if the results have been as expected, you should celebrate with your team. Also, don't forget to share and communicate it with others. But we'll cover this in the next step. See you, and thank you.